Men are funny. I'll just say men. Just as a patient, as a vanity patient. First of all, they want to get in and out with a lot of not talking, not a lot of fanfare. They just, they'd rather be anywhere else but there. What do you feel the difference between a man and a woman play?
Men are very uncomfortable with the word vanity and what that implies. And so I sort of turn that around and say, think of replacing something that's lost, restoring you. I mean, a common denominator in my practice, and this may stand for all plastic and reconstructive surgeons, people that, as the patients get older, not necessarily treating a 18-year-old burn patient, but a cosmetic patient coming in for an elective aesthetic procedure. Most patients that I see are, the common denominators, most people are healthy. I don't exclude people that have diabetes or have obesity, but most people come in here and say, 40 years old, my hair loss makes me look like I'm 52. I go to the gym every day, I'm 62 and I feel great, but this makes me look like I'm 70. Whatever it might be. I don't want to go through my 20s looking like a bald guy. It's really healthy people that get pissed off because they look older than they feel inside. And that's kind of the common denominator, if I can be crude like that. And so restoring something that's lost and sort of framing it that way. I had a patient's wife in the consultation with me and him, and he sort of, like you said, he's like, arms are folded and clearly I am out of here as soon as I possibly can. How much is it? I'm not going to do this anyway. And she said, and I sat back, and she said, he was an active guy. He was in an over 40 hockey league here in the Northeast. Thursday night, he would get playing hockey. And he said, what would happen if you got your two front teeth knocked out next Thursday when you're playing?
Good analogy.
And he said, what do you mean? He said, and I love it. I watched this. I was like, what's happening here? And she said, because she was really supportive in getting the hair transplant. And she said, you don't need your teeth to chew. You can still smile. He said, are you kidding? I get my teeth fixed. He said, well, why? Because I'm not a guy who's missing his front teeth. He said, right. So you would do that, and you pay a dentist $8,000 to replace your two front teeth because you want to replace what's lost. You're not looking to look like somebody different. You're not pulling up a celebrity photo. You're not looking like you want to be 18. You want to look like yourself and feel confident. And the whole air in the room got lighter. I mean, he unfolded his arms, he started to breathe. He said, okay, sure. So he required someone to give him permission to do something for himself that wasn't vain. And
this
so
was his wife who said that?
His wife in
she
my
needs
office.
To be on the payroll. She's good.
Yeah. It was so beautiful. And I was like, and I asked her, can I tell that story? Because a lot of guys come in here and it's like, not exactly kicking and screaming, but they're uncomfortable. Nobody wants to see a hair loss doctor. It's like admitting something is bad. So I tell them, listen, you're not gonna be different than you were, but you're gonna be younger looking perhaps, and you might feel better and more confident. If nobody notices you've done anything, that's great.